Hello, everyone. For me, this is day 2 of a mandatory 6-week break from work because of the COVID-19 virus. I'm a high school teacher in the state of Washington, and initially when our governor announced that schools would be closed in the state through April 27th, all I could think about was how much I would miss my students and how sad it is that they won't see their friends and classmates for at least the next 6 weeks. The second thing that crossed my mind was how many places I was going to go mountain biking. But there are a couple of thoughts that give me pause. I have a friend who works as a psychologist for Kaiser, a healthcare provider here on the West Coast, and he told me that his entire floor has been converted to a triage unit. Kaiser, like other healthcare providers, is converting facilities over and reassigning doctors to handle an expected influx of COVID-19 patients who will need critical care. The word is that some ER doctors are not planning on leaving their facilities until May. Here's why this is relevant to mountain biking during this period of social distancing. Mountain biking is inherently dangerous. Even when we ride carefully, injuries can occur that need medical attention. Most of us will require the attention of specialists if we hurt ourselves mountain biking. Well, right now, or very soon from now, there are not going to be specialists available. They're going to be treating critically ill patients who are fighting to breathe. If I come into the ER with a broken ankle I got from a recreational injury, I'm potentially consuming medical resources during the peak of a pandemic. I have to ask myself if I really want to be occupying an X-ray slot that's needed for someone whose lungs are filling with fluid. I'd feel really guilty if my elective risk-taking put me in the hospital at a time like this. I'm not saying I won't go out and ride my bike at all during this 6 weeks. I'm not saying that I'll judge you if you do. But I am saying that we need to be thoughtful about what we do. A lot of us are planning to go dig on trails with friends. It's easy enough to stay 6 feet apart, but are we going to be sharing tools? Are we shuttling each other around? Are we really staying 6 feet apart? Are we exposing ourselves to risk? These are important things to think about. We have a responsibility to everyone else we share this world with to follow through on social distancing with fidelity. We have an extra responsibility to those who still need to work. The grocery store employees, the public workers who collect our waste, keep the water flowing, and keep our lights on, those people are depending on us to do our part. We're tipping our economy into recession to try to save lives, so it's our responsibility to make this whole exercise worthwhile. Personally, I have chest congestion that has been lingering for the last few weeks. If there weren't a dangerous virus going around, I'd probably go power up a hill and deal with the lung pain without a second thought. But I'm pausing to take care of myself so that I can at least say with a clean conscience that I've done everything I can to keep myself healthy enough to fight this virus off without requiring additional medical care if I should contract it. I know this makes me sound like a buzzkill, but this virus is a buzzkill. Seeing one's loved ones suffer and die is also a buzzkill. I think there is a balance that needs to be struck, because I recognize I can't stay healthy if I just lie on the couch all day either. I don't know the answers, but I do know that medical professionals who think about this stuff more than I do are asking us to stay away from each other. I hope we're all keeping the health and safety of our friends and family in mind when we make grand plans. So, during this stressful period, be thoughtful before you get out there and go ride your bike.